My dear friends, boys and girls, ladies and gentlemen, welcome to Z Media Z Clinic Hair Transplantation Unit. Dr. Priyanka, I learned counseling, what are the investigations. Now, next thing, once they decided, what are the things they are supposed to do the day before, what they are supposed to do that day. Because patient wants to know everything.
Correct.
Meticulously.
Correct, sir.
It's not just like that you come and go away.
Correct.
So what you do, can you able to tell us?
Yes. So once the fitness is obtained, we usually call the patient a week prior, and then what we do, the local anesthetic injection which we are going to use on the day of the procedure, we wanted to rule out if the patient had not undergone any local procedures, they could be allergic to the same injection.
Yeah.
So we don't want to do it on the day of the procedure. So we call the patient 1 week prior the procedure. We'll give a small test dose and check whatever injections and drugs which we are going to use on the day of surgery is going to give them any allergic reactions. And then to be precautionary, we give them some TT injections as well. Again, we also monitor their vitals because usually on the day of the procedure, the patient is very nervous. So all the BP is high, all the heart rate is high and everything. So we wanted to know what is their normal, vitals. So we also check all the vital parameters 1 week prior. We give them all the medications that is required, which they have to start the day prior to the surgery. They will start with their antibiotic doses.
Okay.
Yes. Then we ask them to report on the day of surgery. Usually we start our surgeries quite early in the morning, like around 7:30 to 8 o'clock. We call the patient after having their breakfast and the medications. They report to us.
So they can have their breakfast.
Yes,
Okay.
because usually only when the patient is under general anesthesia, they need something called NPO, nil per oral. They have to do fasting. This is just a local procedure, so the patient need not do any fasting. So they can have a good breakfast, they can take all the necessary medications, and then they can come back on the day of the procedure.
So, okay, next video probably when they come for a procedure, I am going to ask you what they are going to do. So thank you very much, Dr. Priyanka, and thank you very much, audience. Thank you very much for seeing. Thank you.